Hi, my name is Andy Jeter, Vice President of Enrollment Management here at Andrew College. With me today is Professor Katie Brown to talk a little bit about our respiratory therapy program. So thank you for joining us. Katie, tell us a little bit about you and a little bit about respiratory therapy. I think some of us may have heard the term, but don't really have a great idea about what it means and what RT people do.
Absolutely. Respiratory therapists work in a variety of clinical settings. It could be anywhere from a doctor's office working with asthma education or pulmonary function testing to see how well someone is breathing throughout a disease process. They also work in the hospital setting with the neonatal intensive care unit all the way up to geriatrics. You also see respiratory therapists in long-term acute care facilities working with those long-term ventilator patients. In all of those capacities, respiratory therapists are assessing their patient along with the disease process associated with that patient and treatments that we are trying to help that patient get well.
Would you mind kind of describing the program at Andrew College?
Sure. Our program is a 5-semester program. Our application is due every July 1st. And so that student would start in August. So we start in the fall and run for 5 semesters. And once you graduate from our 5-semester program, you're eligible to sit for our national board examination. And our program is created to be 2 days a week. So we do request students come to campus or clinical 2 days during that time.
Okay. And how soon are they actually in the facility doing clinical work?
Okay, well, their first 2 semesters, students will be in the classroom setting, learning the material, the disease processes, and our policies, procedures, how to treat that patient. And then they will go into the laboratory setting and work on those skills. They have to be evaluated by the instructors for each skill prior to going into the clinical setting. So that 3rd semester in the program is summer semester, and that's whenever they will start practicum 1, where they're actually in the hospital setting.
Okay, great. Now you mentioned the application. There's a separate application for respiratory therapy, correct?
Absolutely. Once you are accepted to Andrew College, there's another application for our program specifically. It can be found on our website, and it's easy to download and fill out. You do need references and any sort of current medical licensure that you have. So we need that information. And also your immunization record is very important. We have to have that on file to be able to send to the hospitals prior to your clinical practicum.
Okay, great. Well, thank you so much. Is there anything else you'd like to share about the program before we let you go today?
We're just looking forward to having new students and excited about the future of our program in healthcare.
Okay, wonderful. Thank you so much for joining us today.
Thank you.